Yeah, it's on the record now. So thank you so much, guys. Now that we've done the first part of the dissection and we have cut across the connective tissue in the back between the acromiotrapezius, trapezius on the other side. So now what we want to do is we want to finish off the acromiotrapezius, because we're going to be peeling it off of the scapula. You see, this is the scapula right there. Okay, so you could see, you see how the separation is right there, and then you could see also the separation here on the spinotrapezius, this spinotrapezius, acromiotrapezius. That's what we're working on now. And you must dissect first, peel off this spinotrapezius off of the latissimus dorsi. Otherwise, you cut through it and then you cut both. So you don't want to do that. Again, just like with the levator scapulae and the clavotrapezius. The same deal with the spinotrapezius and the latissimus dorsi. You see what I'm saying? Okay, so here we go. So now what we're doing, we are doing this. We are now finishing off this acromiotrapezius. We cut in the center here. So now we are going here. Okay. So as usual, with your blunt end towards the cat. Do you see how I'm just cutting on the line? I walk the line like Johnny Cash. There was a movie on it, Walk the Line. You know, Johnny Cash and Joaquin Phoenix was Johnny Cash, and he was really doing a good job on it. Okay, so you do this line and you keep going. Do you see what I'm doing, guys? You know, do you see what I'm doing? And you see, now you can see the cobwebs, and you see here, you see how the line is continuing here, and if I'm kind of feeling like I can't see, I do this, and then I take the connective tissue off. You see, this is connective tissue. I can cut. You see, connective tissue. You see what I'm saying? Do you see how when I do the with connective tissue, I can see the muscle fibers now? Okay. So what I do is I put my probe here. You see, I can see my line. Do you see? I see my line right here. Do you see it? So I just make snippets. Do you see the kind of cuts I make? Just so small. So there's this tough connective tissue here. I may have to sort of, you know, I have to cut it. No, I check myself. Always the blunt end towards the cat. You know what I'm saying? Okay. You know, I'm kind of doing it. I'm taking my time, but I'm also being efficient. I'm not like really wasting time, because if you're working on a human being and you might be doing a perfect job, but if you're taking too long, it might be the guy might die on the table. Why? You must make sure you're doing it efficiently and nicely at the same time. You see, because you know, that's how you should be. You know, don't be like taking your time because you want to do a perfect job. That's not how it's gonna work in real life. You see what I'm saying? So that's why I don't want to give you like also an endless time to dissect, because you won't have an endless time to do surgery in the real world. You have time limits. You gotta get on with it. Do it nicely, efficiently, and you know, properly. You know what I'm saying? It comes with practice. That's why they call it medical practice, because you come with reps. How many do you get better and better at it? You know. You see? So there's that. You see now, I can see my line here. All this was white before I removed the connective tissue. I wasn't seeing any of this. I had to work on it and remove it. Do you see now how I have peeled this off? You see? And I keep peeling it off nicely like this. Some of this connective tissue, I make sure I just cut it off like that. You know? Because underneath it, is going to be the spinal, the supraspinatus. These are part of the rotator cuff muscles, okay, that stabilize the deltoid, the shoulder joint. Okay, so spinal trapezius. Supraspinatus. 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 Oh yeah, it's something. Okay, my good friends, don't slap your cat, okay? Okay, so supraspinatus. And why is it called supraspinatus? Because you see the supraspinous fossa, which you guys talk about, and this is the spine of the scapula. See, there's the scapula. See, there's the scapula. So there's the spine, you can even feel it. And then this is supraspinatus, and the muscle below it would be the infraspinatus. And we can only see it after we remove, no, not remove, that's a bad word. After we dissect and separate this from the latissimus dorsi, and we flip it open like this. We leave it attached in the center. Okay, so let me just do that right now. Okay, and I can see my line, so I could start using my thing to pick on it like this. You see what I'm saying? Did you see what I did? I didn't do much, but I did enough. Do you see what I'm saying? Now I can cut. Now here, this spinal trapezius is going to be really well attached here. You see what I'm saying? Just like the clavotrapezius, trapezius and the clavodeltoid junction, the muscle is well connected with the connective tissue. So you have to kind of work it and be sure not to end up cutting muscles here. See? Now I see. Do you see what I did? Now I've got all this access. I could even do this. I could do that. Because I don't want to cut my latissimus dorsi. No. No bueno. Because you don't want to be cutting no muscles. Do you see? Do you see what I did? The patience with which I do stuff and the efficiency with which I do stuff. I'm making a lot of progress, but I'm not wasting time, but I'm doing it properly at the same time. So that's what you kind of try to do. I know this is your first time to do it, but you know, you just have to just do your best. Okay, do you see why I'm saying it's tough connective tissue? Now I did that, you know, and I was doing a small little cuts, and you see, so now, do you see now? So now I finished this off. You see how this is kind of here, like that? Do you see it? Do you see what I did? Do you see? Being like that. And then I take my hand, then the scissors, blunt end towards the cat, I'm slipping away. As long as I can see the connective tissue, I'm allowed to cut. The only thing you don't want to cut is the muscle, that's all. Unless I specifically say, let's cut this muscle. And I'll say it just like in those words. Let's cut this muscle. And we do cut it. You know what I'm saying? Oh my God, look here. And this right here is the teres major. This is the infraspinatus, and you can see the spine, supraspinatus. Do you see what just because I just did the small line here, I didn't do much, but it's enough. It's enough. Okay? So now I keep working on this edge right here. Do you see what I'm doing? Whenever I can't see, I don't just go ahead and cut. I remove the connective tissue so that I can see. You see what I'm saying? I like to be able to see what I'm doing. And then each time I check myself, I put it the blunt end towards the cat. Being like that. And I'm doing it. You know what I'm saying? It's just patience. You know, I'm patiently peeling away stuff, you know. That's how you do it, you know. The patience and efficiency. No shortcuts. Bing, bang, bing, 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 bing. see how I kind of put my probe in there just so that I could see the connective tissue, and then I spread it a little bit, and then, you know, I'm just sort of patient about it, you know. I'm real patient about it, but, and if the connective tissue is kind of too hard, this is the latissimus dorsi, latissimus dorsi. You see this one? Do you see my latissimus dorsi? I can see this connective tissue, so I do this because this connective tissue is so hard that you could tear muscle with it. And you could put your little finger in there, and you could do this number here. You know, this, put your little finger. Look here, look how nice that looks. Isn't that nice? This is the teres major, infraspinatus, infraspinatus, supraspinatus, supraspinatus, and this is the acromiotrapezius, trapezius, right? Levator scapulae, levator scapulae. This is the clavotrapezius, trapezius. And down here would be the deltoid or clavobrachialis. It's still deltoid in the human, okay? Down there. So I'm gonna finish this off, and then we have a lot of muscles in. We didn't do much. We didn't really separate a lot of things here, but we got all sorts of muscles. It's not even funny. It's almost like Christmas time. Oh man, Christmas is my favorite time. You know, in December. It's my favorite time. And I'll be in sunny Zimbabwe. I won't be doing none of this white Christmas you guys deal with when you're here. It'll be sunny for me. Because I go to Zimbabwe at Christmas. You see, that's one of the reasons I look forward to Christmas. Not only that I'm going to Zimbabwe. You know what I'm saying? So my cat seems to be tough. You know, this connective tissue here that is separating the spinotrapezius, trapezius, and this. So I'm having to be more careful than I really want to, but I have to be. You know what I'm saying? I'm just trying to show you that sometimes just being patient about it is the best medicine. You can't just do rush and get impatient with it, because once you get impatient with it, you start to just cut. Because normally this separates very easily from this. Do you see how mine is like welded onto this one thing? You know what I'm saying? And I can't help it. You know, there's nothing I can do about it. I just have to work with what I got. It's like super glue or something. This thing that normally once I do this, I'm able to peel it off nice and smooth without a problem. You know what I'm saying? Which is might be the case with you guys. Mine, for some reason, is refusing. So it's taking a little longer than I would normally take, but I'm just dealing with what I got. You know what I mean? So you could be doing surgery yourself. Sometimes you get something that's difficult, a human that's difficult, you know, because they may have some other issues and stuff like that, or, you know, something. So you just have to work with it. You know what I mean? The thing about medicine is that you just have to think on your feet, just do the best thing you can. You know what I mean? And as long as you do your best, it's okay. You know what I mean? Because sometimes, you know, patients do die and stuff, but you can't help it. I mean, but if you did your best, then you'll be okay. You'll be comfortable, because you can't save everybody. As long as you just do your best, and then the rest is up to God. You know what I mean? It's like a washer. You know, my washer sounds the same when it's done. I know the dryer. I noticed these things. What is that? Yeah, something is going. I hope it's okay. We've been getting all sorts of internet downage and outage and whatnot and my heritage. So I'm hoping my heritage will be all good and handy dandy, because they did some updates on the first. And I'm hoping, because you're going to be needing it. You guys are going to be going to my heritage and watching these videos, okay? Please. Pretty please. Especially for the class, because I'll be gone. I come back on Thursday. You see what I'm saying? Hey, just kidding. So funny. So funny. So this cat is something else. Most of the time, I never have to cut this connective tissue between the latissimus dorsi and the, you know. I never have to cut this connective tissue. For the most part, I usually just have to peel it off. My good friends, are you watching? Are you looking? Yeah, man, my good friend Jose says, of course. It's like, okay, as long as you're watching. Like I say, it's normally not your cat. You'll probably find that this is gonna be as difficult as mine. Okay, I got snookered. I just checked. I didn't get so lucky. You know, but yours is not going to be as difficult. As long as you're following the same procedure, you'll find that you'll probably be able to separate yours a lot easier, because it's not normally this hard. Okay, I'm just letting you know what to expect. But at least if you see me doing this, you guys are not going to do rash things, correct? Because you seen me do the labor of love for this deal. I hope it's all good. We don't have to evacuate or anything. I'm kidding. We're good. We're doing good. Do you see what I'm saying? Being now I can see. You see my latissimus dorsi? You see this? My latissimus dorsi? You know, I can separate it. Do you see? Now this is the spinal trapezius.